So I'm just finishing today's infusion. I have about an hour left. I'm doing okay so far. Just kind of the usual. Been sleeping all day. I'm home from my 5th IVIG infusion. We upped my dose today to my full dose of 40 grams. So if all goes well and I handle this infusion all right, I will now be doing 40 grams every 3 weeks. And so that's kind of exciting. Hopefully it all goes well. The infusion itself went pretty smoothly, all things considered. The only thing, this happens with every infusion, but like towards the end of it, my GI symptoms kind of flare up. I get a lot of bloating and discomfort, and then I also start to get kind of this like chest tightness. Like when you get really anxious, getting some heart palpitations, like it's a little harder to breathe, like harder to take deep breaths. That's kind of the feeling. Again, it's nothing like crazy. I just get a little of that towards the end of my infusion, and that usually goes away after we finish infusing. And then I like sometimes have a little bit of like chest heaviness and shortness of breath throughout the night. Nothing bad, just like a little bit of that is usually what happens. It takes a few days to recover from it, but overall I'm just so tired right now. It was a really long day, and then an hour of traffic home after. So my plan is just to eat some food and go straight to bed because I'm so worn out. And then I will make sure I get all the questions that you guys left me on my Instagram post. I'm doing an IVIG Q&A if you didn't know that from the title of this video. I'm gonna do all that tomorrow. I was hoping to like kind of do it while I was infusing today, but the clinic was super busy and I had to share a room with 2 other people and just like didn't happen. So I'll get to all those tomorrow when I'm more rested. So I'm 2 days out from my last IVIG infusion, which was at my max dose of 40 grams. And like I said before, went well, it went smoothly, and my recovery so far hasn't been too bad. I did have a lot of pain the night of the infusion. I do tend to get a little bit of pain flare up after my infusions. I was able to manage that without pain meds and get some sleep and calm all that down, and since then like it hasn't been crazy. I've been, you know, just kind of worn out, and I definitely still have some GI upset. IVIG tends to kind of cause a little bit of GI flare for me, and I think in general that's like a pretty common side effect. So other than that, nothing crazy. So I'm hoping it continues that way. But in my last IVIG video, I think I said it in my last IVIG video, but I also put this picture up on my Instagram, which asked you guys to leave any questions you have about IVIG, and I would answer all of them in this video. So let's get into it. I have a bunch of questions. First big question a lot of people had was like, how much does it cost? How did you get coverage for it? Like, how did you get a doctor to cover it for Lyme? And so let me clear all that up. First of all, IVIG is very expensive. It's like $5,000 to $15,000 per infusion, and you don't just get one infusion. I'll get into the length of treatment in a moment, but it's a pretty extensive treatment and it's very expensive, so it's not really feasible to pay out of pocket for it. And it's obviously very expensive in treatment, so the insurance companies don't want to have to cover it, so it can be really hard to get coverage for it. And there's only a few approved diagnoses. I'm actually not doing IVIG for Lyme disease. Lyme is not an approved diagnosis for IVIG coverage. I basically have a long health history if you've been following me for a while, and I started seeing a new immunologist and neurologist when I moved to Colorado, and both of them felt like IVIG was the next best step to help with my healing, based on my medical history and treatment history and all of the things I've tried to heal, and issues that are maybe related to Lyme but maybe not. So I have had a history of chronic infections since I was a child, as well as a history of low immunoglobulin levels. So that was evidence for my immunologist to suspect that I would benefit from IVIG, and it's also, I think that's enough to get coverage for it. So I'm not exactly sure like all the details of how I got it covered, but I know it was under a diagnosis of like chronic infection and low immunoglobulin levels. And I also did a bunch of tests with my neurologist and tested for CIDP, which is chronic inflammatory demyelinating polyneuropathy. So that's why it's abbreviated to CIDP. So those two diagnoses together from my neurologist and immunologist got IVIG covered with my insurance company so that I could get the treatment. I actually was approved for IVIG in the past but didn't do it. So this isn't like brand new to me. It's just that I long story short, I didn't do IVIG when I've been covered before, but I do have this history with low immunoglobulin levels and chronic infection. But we are hoping that IVIG will help repair some of the damage that has been caused by the Lyme infections and the co-infections, and some of the treatments I've been on over the years. So fingers crossed for just like a crap ton of healing over the next year. I do have opinions about using IVIG for Lyme treatment, and somebody asked me that, so I'm not gonna go super deep into it, but I will say, like, personally, based on the research I've done, IVIG, I wouldn't use it as like a first line of defense for Lyme treatment. I think it's kind of like stem cells. Like, you really would have to build up your body first, and I don't know that it's really the best treatment for Lyme itself either. Like, there's no research on that. So I just, you know, I know a lot of Lyme doctors are starting to use it, but they're usually using it in patients who have immune system issues to begin with. Like, I've noticed that a lot of patients, and I think this is kind of true for Lyme, like, I think a lot of people carry Lyme, probably most of the population. There's plenty of carriers who don't get sick. I'm sure if my mom got tested, you'd find Lyme bacteria in her body, but she's totally healthy. And I think a lot of that has to do with like your immune system to begin with. And so I think probably people who get really sick with Lyme have compromised immune systems to begin with. And so if they've been living with primary immune deficiency their whole life, like, yeah, they're gonna get really sick from Lyme. And so you need to boost their immune system anyways with IVIG, but it would probably help treat the Lyme in the long run too. So it's a little bit of confusing, lots of different pieces to it. And so if you're dealing with low immunoglobulin levels, yes, like IVIG is designed to boost those, which would help fight infection. Also, a few new studies out, most of them are case studies or case reports, showing like having used IVIG in certain patients with dysautonomia or nerve damage to the gastrointestinal tract, and how the IVIG helps in recovery. And I have a lot of damage to my gastrointestinal tract, to those nerves. So my GI doctor's really a fan that I'm on IVIG, because combined with his treatments, it should help repair the nerves to my GI tract so that I can get better motility. I'll link some of those case studies that I found below, and there's, you know, they're finding that IVIG may help with autoimmune dysautonomia, which isn't necessarily what a lot of you have. Like, there's no studies on POTS specifically, but they are doing more studies on the benefits of IVIG for diagnoses that are outside like the current like list of 5 things that it treats. So that's pretty cool to see some of that science coming out, and I'm doing more research about it and looking into some of these more complex chronic illnesses and how new treatments can benefit patients. So just wanted to throw that out there. A lot of people asked where I go for this treatment or how it works. Basically, what happens is, for me personally, so I go to my immunologist clinic. They do a bunch of IVs there. They do IVIG there. So I go to the clinic, like I said before, every 3 weeks for my infusion. You can also do it through home health care system. So you can have like a nurse come to your home. It's a process to like get insurance to cover that. So I just haven't gotten into that, and I don't mind right now. I don't mind going to the clinic, just because it actually gets me out of the house, and it's nice to have like that support team there. And I have a couple friends who I've met, you know, who have IVIG on the same day, so I get to socialize a little bit. But anyways, so you'll either go to the clinic or hospital, like wherever your doctor is, to do the infusions, or you can do them at home. Some people, also how often you do it and your dose depends on your weight and your diagnosis. So I know some people do it every week, some people do it once a month, some people do it every 3 weeks. So the way it will work, or how often you get it, or what your dose will totally be dependent on your situation and how your doctor uses IVIG. The other thing is that people ask a lot about like how long I'll be doing the treatment for. I don't have a definitive period, but it will be for at least 6 to 12 months. I've had multiple doctors tell me you need to do it for at least 6 months to be able to start noticing changes, but it may take longer than that. And so you just have to keep it. I'm covered. I have insurance coverage for a year right now before we have to reapply. So right now we're just kind of going with the flow, but it's a pretty long treatment. It's not like here you do, you know, 3 infusions or 2 months of treatment and you're done. It's pretty extensive, so I am prepared for that. We've also found my doctor does regular blood work, and within the first 4 or 5 infusions, we've already noticed some benefits. So some of my lab values are improving, which is great. So hopefully I'll start to feel that on a more physical level, not just deep physiologically in my cells. Another question I got a lot of was like, what type of doctor is treating you? So my I'm getting IVIG through my immunologist. But a lot of times it's through an immunologist or a neurologist. Those are usually the 2 doctors that work with and treat IVIG as far as I know. Everyone I've talked to who does IVIG is either going through an immunologist or neurologist. So since the diagnoses that are covered are usually related to immunology or neurology. So that's probably who you'd have to see to find out if IVIG is right for you, as far as I know. I've actually never brought up IVIG to a doctor. It's been brought up to me. So when I originally got it covered years ago, it was because I had low immunoglobulin levels and my doctor felt like that would be helpful. And then when I started seeing my immunologist here to try and figure out like what's going on with my immune system, because I also have some autoimmune issues, he thought IVIG would be the next best step. So in terms of like talking to your doctor, I got this question about like, how do you talk to your doctor about IVIG? Whenever I read about a treatment that I'm wondering if it will be helpful, I go in and I say, hey, I read that XYZ treatment might be helpful in certain conditions. I'm wondering what your thoughts are in my case. So be very open and honest with them. You don't go in there and be like, this is treatment I want to do and prescribe it. You know, you have to be very, I think, go in open-minded so that they're open-minded, and when one person gets defensive, the other person does. So you just have to go in there and be honest and open, be like, hey, I read about this and I'm just curious your thoughts with my treatment. Another question, I've actually gotten this a couple times, was, are you afraid of getting reinfected with Lyme or co-infections from IVIG? So because IVIG is not tested properly for extensively for these infections, since it's kind of like giving blood, they're not testing for Lyme they're testing with a CDC test, which we know are inaccurate. So I've talked to my immunologist about this, and he is he's not a Lyme literate doctor, but he's Lyme familiar, and he is not concerned. And so to be honest, I'm just trying not to worry about it. I asked another friend about it and she was like, I just don't think about it. And that's kind of what I have to do, because when I felt like this was the right treatment for me, like my gut instinct was, this is the right next step and you need to be doing it. And my gut instinct is like never been wrong. It's usually pretty accurate. And so I'm just focusing on healing and supporting my system and my body and trying not to worry about that too much. I know a lot of other people may be super concerned about it, but it's just, no, I'm not trying to freak out about it at all. And I do trust my doctor right now. Like, we've had a lot of conversations and he's been very open with me when I ask direct questions. So I'm trusting him at the moment. It took a long time to get here and I just feel like it's the right thing to do. I just wanted to add this little clip in because I was actually at a Lyme conference this past weekend and I got to hear more doctors, including my immunologist, talk more about IVIG and the safety of it with Lyme disease patients. So I wanted to add on to you know, the question of am I scared of getting reinfected with IVIG? And IVIG actually, if they let it sit for like 6 to 12 months to see if pathogens grow in it, then it goes through like a 12-step cleaning process. It's like heated and frozen and all this stuff to like clean it and kill pathogens in it. It's PCR tested like throughout this whole process to check for infections and different organisms and whatnot. And yes, we all know like things can sneak through. But, and you know, there's always a chance, like anytime you're doing any type of transfusional type therapy, like there's a chance there could be a disease right now that we don't even know about that's being transmitted, you know, and the doctors will definitely admit that. But overall, also the IVIG is cleaner. Like, I would be more worried with blood transfusions because the organisms really, like the red blood cells seem to hold that more, and IVIG is the immunoglobulins, so the antibodies that are attacking the disease anyways. And this was really emphasized by both Dr. Horowitz and my immunologist. So it made me feel more comfortable with using IVIG, and my doctor has been using IVIG for like 20 or 30 years, and he said he personally hasn't seen people get sick or have disease spread with these transfusions or with these IVs. So I don't know, overall just like it calmed me even more, and like I said before, this felt like the right next step and the right treatment, and all my doctors agreed. And I have several doctors who are Lyme literate and we're on board with it. So yes, there's always risks and benefits, and there's that one person that does get sick or whatever from a treatment or have the adverse reactions. There's always that chance, but it felt like the right thing. So I just want to add this clip in and let y'all know that I have really talked to doctors about it and learned more about IVIG and the risks of reinfection with it. It just, like I said, gut feeling that this was the right next step. A lot of people asked me kind of people who were starting it or whose doctors had suggested it. They were really nervous about it, and they wanted what's the biggest tip I would give someone who's starting IVIG or someone who's scared of it. The biggest piece of advice I would give is, first of all, make sure that it feels like the right treatment for you. I think our guts and our bodies and our instincts know what we need and what feels right and what feels wrong. And for me, IVIG felt like the right next step. There have been plenty of treatments doctors have suggested that didn't feel right, and so I didn't do them. So first of all, make sure it feels like the right thing for you. If it does feel like the right thing and you're still like very scared and nervous about it, be prepared. This is like my life motto, is be prepared. And so before your first treatment, get your shit together. Like, I always meal prep for the week before my treatment so that I have food, and if I feel crappy, I don't have to cook or worry about anything. I have food ready to go. I can just grab it and eat it. I make sure I have plenty of all my electrolyte water, my coconut water, plenty of liquids in the house. My house is stocked with anything I can eat so that if I'm just feeling awful, I don't have to leave the house. I make sure that I have clean sheets on my bed, lots of pillows, I'm comfortable, I have everything that I need in my home. I also make sure that I've been really lucky that my parents come for each infusion so far, and so I have that support system. I'd say make sure you have a support system. So either have friends and family around who can take you to your infusions, be with you at your infusions, or help you out afterwards, or if they can't be there like physically the whole time, I let my friends know. I mean, even when my parents are here, I let my friends know. I say, hey, I have an infusion this week, or I'm going up in dose this week. I have no idea how I'll feel. Can you be on call? Like, if I need you, can you come over and cook for me, or can you come over and help me, or whatever. And I've been lucky. I have amazing friends who are willing to do that. I make sure that I rarely take medications that I don't have to. I just don't like meds. So I don't ever take pain meds or anything, but I have in my house I have Benadryl, I have Zofran, I have Lee, pain meds. I have all of those things in my house in case I feel bad. So I'm just totally prepared for any reaction that could happen. I think that's the biggest thing. It's when I'm prepared and I know that I have every scenario planned out and plan for what to do if something happens, I calm down and I'm not as scared, because I'm I know exactly what I need to do if XYZ thing happens. So that would be my biggest tip, is just prepare. And then in my last IVIG video, which I'll link, I share my top 5 tips for IVIG. Hydration, your pre-meds, resting. Don't plan anything around IVIG so that you can rest before it and rest after it. Again, just prepare for it. That is my biggest tip that I can give. The other thing I quickly want to say is everyone reacts differently to IVIG. And also, I talked about this before, we react differently to the brands as well. And so I've had to switch my brand because I was reacting to actually the additives and the preservatives in one brand, and I've been doing a lot better with this second brand. So if you have a bad reaction, just be in touch with your doctors and the nurses. Talk to them about how you're feeling. Be very communicative with your doctors. Understand that there are a lot of things that can be adjusted. So if you have a bad infusion, if you feel like crap during the infusion, tell your nurses right away, because there's things they can give you to help. But also, if you feel really bad afterwards, let your doctors know, because they can adjust things. They can change your pre-meds. They can change the brand. They can change the dose. There's a lot of things that can be adjusted to make your infusion better, and part of it is just going into that first one and seeing how it goes. And for me, I want to get a baseline. So I won't take a lot of pre-meds when we change my dose or brand or anything, because I want to know how I'm going to feel on that and know that I'm not reacting to like one of the meds or something. And then if I react to the infusion, I'll be like, okay, next time I need to adjust this or take a pre-med or something. So just be communicative, just, you know, have your support system, take everything that you need for your infusion to make you feel comfortable, whether that's like I take my own blanket, my own pillow, music, food, you know, just do what you need to do to feel comfortable and safe in the space and during your infusion. That helps a lot. And then, you know, be communicative, because there's a lot of ways to adjust your infusions to make them better if for some reason it didn't, you know, it was really hard to get through. So just remember that. I think that answers all the main questions that I got. If I missed anything for any reason, I hope I didn't. But if you have more questions too, don't forget to leave them in the comments. I will be sure to answer them and make sure that I help as much as I can. Obviously, I'm not a doctor, I'm just sharing my personal experience, so please remember that. You know, hit that little red subscribe button, help support my channel, which I always appreciate. Like this video if it was helpful for you, and share it with a friend if you feel like they may get some benefit from it as well. And then I think that's it, and I'll see you all in the next video.